Radio City presents Ask Maarga.
Now let's check out the various questions that you have about anxiety disorders. Anxiety is basically a very unpleasant emotion or feeling a person experiences when in a difficult situation. It's quite a normal emotion that everyone experiences. The emotion is very important to help us motivate, get out of the difficult situation as well. Anxiety is experienced at various levels. At a physical level, it feels like a lot of symptoms like breathlessness, breathing fast, faster heartbeats, feeling sweaty, feeling very jittery can be experienced at a physical level. At an emotional level, you might feel very irritable, on the edge, a very unpleasant feeling in general. At the thought level, anxiety makes you feel something negative is going to happen, an impending doom, lot of negative ruminations. Like mentioned, anxiety is a very natural emotion. It becomes a problem or a disorder when you're experiencing anxiety always, you're anxious always, feeling on the edge always, or you're feeling anxiety which is over and above the expected level in the given situation, or you are feeling anxious without any reason. And this hugely affects your life in a very negative way, then we call it as a disorder. So the various anxiety disorders that we come across is generalized anxiety disorder, which is basically the person feels on the edge always, has a lot of day-to-day worries and has a struggle dealing with day-to-day things. The second would be panic disorder, wherein a person experiences something called as panic attacks, wherein the person feels intensely anxious for a short period of time. It may not be due to any reason that the person has panic attacks. Few other anxiety disorders could be social anxiety disorder, where a person is extremely anxious in a social situation and is unable to perform in front of people. The fourth would be phobia, which is intense fear about a particular situation or being in a particular situation or being with a particular thing. So we at Maarga here work as a multidisciplinary team. My team consists of psychiatrists, clinical psychologists, psychiatric nurses, occupational workers and social worker. So when a patient approaches us having anxiety symptoms, the first part would be assessment. The assessment would be done by a psychiatrist through form of interviewing, understanding the level of anxiety that the person holds, the impact that it has on the person's life. So psychologists then do psychological assessment to know the level or severity of the problem and also how much it has impacted their life. Once the assessments are done, we move to the treatment phase. Treatment options are basically can be divided as medications and non-medical form of treatment. The non-pharmacological form of treatment plays a major role in treatment of anxiety disorders. Trained clinical psychologists have various therapies to help you with the anxiety disorders. Few of them that I could name here would be cognitive behavioral therapy. Cognitive behavioral therapy basically helps in dealing with your thinking process, your emotions and the way you're behaving. And then you also have some applied relaxation therapy, which would help you relax in situation which you would be otherwise anxious in. You also have role playing, which helps especially in social anxiety disorders, wherein you are able to address your anxiety around social situations. You also have supportive psychotherapy, which helps in dealing with your coping skills, with enhancing your coping skills with regarding to some situation, overwhelming situations in your life. The second part of the treatment would be the medications. In some patients who have anxiety disorders, which may be moderate to severe, may require some medication to help with the anxiety disorders. The medications that we use are also called as antidepressant medications used for anxiety. One thing to keep in mind is for treatment for anxiety disorders takes some time for it to act. You need to follow up with your psychiatrist and psychologist and continue taking help.
Radio City presents Ask Maarga.